Assalamualaikum warahmatullahi wabarakatuh, and hi everyone, we are from group 3 and today we are going to present on our topic, which is autism. I believe that most of you have heard about autism before or maybe know someone with autism. So you may want to understand or know a little more on autism, right? Before that, what is the meaning of autism? Autism spectrum disorder or ASD is the presence of abnormal or impaired development that is manifest before the age of 3 years, characterized by abnormalities of social development, communication, and restrictions of behavior and interest. Besides, autism is a developmental disorder that appears in the first 3 years of life and affects the brain's normal development of social and communication skills. According to World Health Organization, about 1 in 160 children have an autism spectrum disorder, while Centers for Disease Control and Prevention (CDC) stated that ASD is more common among boys than among girls. Next, there are a lot of signs or symptoms for autism. The symptoms experienced by a person may be different from others. Here are the most common signs and symptoms among them. First, people with autism tend to avoid eye contact and non-responsiveness. You can see that usually normal people will immediately respond and look at you when you call them, whereas people with autism may not necessarily have skills to do that. They will look away during the communication process. Next, delayed speech development. Usually, children in the age of 2 to 3 years can already speak or construct a beautiful sentence, but the speech of autistic children may be limited to one word only. The other thing that we will notice on autistic people is they prefer to be alone. They will have difficulty getting along with others and often play or sit alone as they have zero interest in engaging or interacting with other people. They prefer to be in their own world. Autistic person also enjoy doing repetitive activities such as shaking hands and jumping aimlessly. Another thing that we will notice is they will repeat every single thing that you say. For example, when you say a phrase, they will copy every single thing that you say. And this is called as echolalia. Besides, they are also very sensitive to taste, smells, and sound. A normal sound of a fan or vacuum can be a source of significant distress for them. They also tend to become aggressive. Last but not least, autistic people are facing trouble to interpret what others feel. A person with autism tends to ignore other people or appear insensitive to others' needs, thoughts, or feelings. There are still lots of symptoms of autism like ignoring the danger, built in the object in a ruler, sleep problem, and others. But I just take the most common. I think that's all from me. Let's move to the next presenter.
Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Aino Azrin binti Ahmad Ramizi. I'm going to explain the cause of autism. First, there is no single cause for autism spectrum disorder, but it is generally accepted that it is caused by abnormalities in brain structure or function. Brain scan shows a difference in the shapes and the structure in the brain of in children with autism compared to neurotypical children. Researchers do not know the exact cause of autism but are investigating a number of theories, including the links among heredity, genetics, and medical problems. One gene has been identified as cause of autism. Researchers are searching for irregular segments of genetic code that children with autism may have inherited. Some harmful substances that the mother consumed while on pregnancy have been associated with an increased risk of autism. Okay, next I will move on to the type of autism. There is a wide range of type of autism, but I will explain 3 major type of autism. So the first type is Asperger's, aka level 1 autism. Child with level 1 spectrum disorder will have above average intelligence and strong verbal skill, but will experience challenge with social communication in general. A child with level 1 autism spectrum will display the following symptoms: inflexibility in thought and behavior, challenges in switching between activities, executive functioning problems, flat monotone speech, the inability to express feeling in their speech or change their pitch to fit their immediate environments. And they will also have difficulty interacting with peers at school or home. The second type is Rett syndrome. For Rett syndrome is a rare neurodevelopmental disorder that is noticed in infancy. This disorder mostly affects girls, although it can still be diagnosed in boys. Rett syndrome presents challenges that affect almost every aspect of child life. The good thing is your child can still enjoy and live a fulfilling life with a proper care. So the common symptoms for Rett syndrome is loss of standard movement and coordination, challenges with communication and speed. The last type that I will discuss is the childhood disintegrative disorder, also known as Hallow syndrome. It's a neurodevelopmental disorder defined by delayed onset of developmental problems in language, motor skills, or social function. The cause of CDD is unknown, though researchers link it to the neurobiology of the brain. Childhood disintegrative disorder is more common in boys. Out of every 10 cases, 9 will be boys and 1 will be girls. In CDD, the child will have a normal development up until the time when the disorder starts. The child may lose any of the following skills and abilities. First, toileting skills if they had already been established, acquired language or vocabularies, social skills and adaptive behavior, and some motor skills. So that is all from me. I will pass to the next presenter.
Some quick data and statistics. So autism is reported to occur in all racial, ethnic, and socioeconomic groups, which we know, of course, and it is about 4.5 more times common in boys than girls. Studies in Asia, Europe, and North America have identified individuals with autism with an average prevalence of between 1 and 2%. Parents who have a child with autism have a 2 to 18% chance of having a second child who is also affected. Autism tends to occur more often in people who have certain genetic or chromosomal conditions, which we know. Children born to older parents are at higher risk for having autism, and a small percentage of children who are born prematurely or with low birth weight are at greater risk of having autism. Autism commonly co-occurs with other developmental, psychiatric, neurologic, and genetic conditions, which I think Hannah and Luigi are going to talk about. But co-occurrence of one or more ASD developmental diagnosis with autism is about 83%, and co-occurrence of one or more psychiatric diagnosis is 10%. 40% of children or adolescents with autism meet criteria for an anxiety disorder. ADHD is present in about 30 to 80% of these individuals. Approximately 48% of individuals with autism have intellectual disability. Approximately 40% also have average or above average IQ, with 20 to 25% with a borderline IQ. A higher proportion of females with autism have intellectual disability compared with males, and approximately 1/3 of people with autism remain nonverbal throughout life.
Hi, Assalamualaikum everyone. So my name is Amar and I'm going to talk about meltdown and shutdown in people with autism. So we all experience varying levels of stress in our daily lives. Many people with autism experience higher levels of stress and anxiety, which can make things even more difficult. This means they may reach crisis point more quickly. Sometimes this crisis point is visible through either a meltdown or shutdown. Each person will experience this crisis point differently. So what is meltdown? During a meltdown, a person may show extreme behaviors like shouting, self-harm, aggressive behavior, and repetitive behaviors. During meltdowns, there may be a risk of harm to the person themselves or to others. Meltdowns can be very distressing for the person with autism as well as people supporting them. During shutdown, a person may either partially or completely withdraw from the world around them. They may not respond to communication anymore, retreat to their room, or lie down on the floor. They may also no longer be able to move from the situation they are in, no matter what it is, for example, in a shopping center or classroom. Shutdowns tend to be more discreet than meltdowns and may sometimes go unnoticed. However, like meltdowns, they are a person's response to reaching a crisis point. Sometimes meltdowns can turn into shutdowns. A person may show outward expressions of stress to begin with, then withdraw until their stress levels have reduced. In these cases, it is important to remember that the withdrawal itself isn't a sign that stress levels are reduced, but may be a necessary step for the person with autism to recover from the situation. So what causes meltdown and shutdown? Meltdown and shutdown are usually caused by high levels of stress to a point where the person with autism is no longer able to cope. This can be triggered by any situation and can be the result of an accumulation of stressful events over a period of time, in hours, days, or even weeks. We are all able to deal with a certain amount of stress. Our days tend to be a combination of stresses and opportunities to de-stress. People with autism tend to start their day with a higher level of stress and anxiety, leaving them with less room to cope with additional stress, so they may reach crisis point more quickly than others. So how do you support a person with autism during a meltdown? Firstly, know the person you are supporting, as this person will need to be supported in their own way. If they are not at risk of harming themselves or others, leave them alone. Keep calm, do not ask them too many questions, and don't tell them to calm down. Instead, give them guidance on how to calm down. And consider whether you can use their special interests to help them relax. And how do you support a person with autism during a shutdown? Give them the time to withdraw and recover. Consider whether you can use their special interests to help them come out of their shutdown. And some people with autism may like some contact during a shutdown, like a hand on their shoulder or a quiet word. This is entirely up to the person, and you may discuss with the person with autism when they are not stressed how they would like to be supported.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Mirzan bin Mohami, and I will be talking about communication and interaction tips towards people with autism. The first tip is be patient. It takes people with autism more time to understand things. They need more time to take in information. So we should not be rushing when we want to talk to them. Try to speak with them at a slower pace. So this can help them understand what we are trying to convey to them. Second tip is physical communication. Their attention span is very short. So it is hard for them to remember things, and we need remember things and focus on something when we want to talk to them. So we need to communicate with them through physical activities instead. This will help them interact with people better. The third tip is try to understand. Let us open our mind, be more open-minded to their point of view, because people with autism spectrum disorder see the world very differently. Understanding how they perceive the world will help us communicate with them more efficiently. So because we can speak with them with through their point of view instead of our point of view. Fourth tip is using visual and audio aid. Sometimes communicating through speech can be hard for people with autism, because especially children, because they have trouble in developing their language at a young age. So having visual cards or speech command from gadgets, so they could push a button or show us pictures to us to let us know what they want to say to us. The fifth tip is positive reinforcement. It is hard to interact with people with ASD. Sometimes the children, some of the children, mostly children, will throw tantrums to seek attention from their parents. So instead of punishing them for throwing tantrum or doing bad behavior, instead we ignore their tantrums and reward their good behavior to instill these positive reinforcement. So this can help them understand that doing good behaviors will get them rewarded, and they will soon forget about doing more bad behaviors. And final tip is to make it simple. And if we want to talk to them, try to make it simple, meaning that don't use complicated words. Try to make it short. The sentences are short, simple, and easy to understand. It is straightforward. Instead of using long and confusing words, try to shorten it down and help. And it is far easier to understand, because it is simple, much simpler for them to, take in that information. So make it simple if you want to talk to them. That's all from me. Thank you.
Bismillahirrahmanirrahim. My name is Muhammad Baliasha bin Saharuddin, metric number 1711979. And moving on, I will be presenting about on suggestion on how the community can help or contribute towards the autism community. So the first point that I want to discuss is that knowledge is power. So when you educate yourself about autism, you will be better prepared to recognize the signs and feel more confident when interacting with someone with autism. So autism is a spectrum disorder or ASD, meaning that there are many variations or as to how high or low functioning a person is developmentally or intellectually. Many people, depending on where they are on the autism spectrum, live as high functioning adult. Basically, the more we know, the better interaction that we can have with them. So the next point is to promote autism awareness. After we have educated ourselves, our next job is to educate others, especially the youth, so they can have a better understanding on what is autism. Uh, Increasing awareness can lead to better understanding. Example, decades ago, people may have gossip, whisper, or stare at a children with ASD displaying awkward communication or social skills. But today, more and more people have started to realize that while autism may not be in their home, it is in their community. So, increasing understanding can also evoke greater empathy, and greater empathy will lead to increased acceptance. Every parent of a child with ASD worries about what will happen to their child if they are no longer here or gone. So no matter how old your child is with ASD, you want them to receive the same support and acceptance from the rest of the world as they get from their immediate families, therapists, and also caregivers. So one of the way we can contribute is through the social media such as Facebook, Twitter, Instagram, and all of that, where we can reach out to many people and educate them about ASD by sharing some articles or everything that are related. So the third point is that the growth in community inclusion. So first and foremost, let's remember that the young children with autism will grow into young adults. The need for inclusion does not stop after high school, but instead it is a lifetime goal for everyone. So from a young age, we are asked, what are you going to be when you grow up? What are you going to do when you work? Those are difficult questions for individuals with autism to answer, not because of the deficit in communication, but because of limited opportunities in their surrounding community. So, for someone with a developmental disabilities, finding vocational opportunities can be very difficult. We need places of employment to allow people with autism and other developmental disabilities to showcase their talents. So, working opportunities in a small or large corporation is a rare occurrence for them. So, basically, they are not asking them to lower their bars or standards, but asking them to widen their doors. So, such as make the necessary accommodation to hire individuals with disabilities and give them a chance to showcase their skills. So, moving on to the conclusion. So, the first one is that autism is not a disease. Autism spectrum disorder is a neurodevelopment disorder that impairs an individual's ability to communicate and interact with others. There is more than one type of autism caused by different genetic combinations and environmental factors. Individuals with autism have issues with communication, social interaction, and activities. However, there is who they are, not what they have. They are not sick. Next, autism cannot be cured by medicine. So, autism is a lifelong disorder. Individuals with this disorder can live independent, productive, and comfortable lives. With therapies, interventions, and education, the challenges that come with autism can be managed by them. On the other hand, medication can be used to deal with other disorders or problem behaviors that are caused due to autism. And last but not least, they also have needs and emotion. So ASD impairs social interactions of an individual. This does not mean that they don't want to socialize. They may seem unfriendly or reluctant on the outside, but this result from the fact that they are struggling with their social skills and are unable to communicate their feelings. So the communication should be direct with individuals with autism, but this definitely does not mean that they cannot feel happiness, sadness, empathy, or compassion. They just have a different way of expressing and understanding them. And that's all from us. Thank you for listening and have a great day.